In this episode of Aging Unscripted, we'll dive into the complex web of Medicaid funding for long-term care, the ripple effect of federal cuts on state budgets, and how these changes can threaten care and services for our growing older adult population. Tune in to understand the issue and what you can do to make a difference. Welcome to Aging Unscripted, a podcast with a different perspective on aging. Here, we'll explore a wide range of topics aimed at celebrating, supporting, exploring, and honoring the aging journey. I'm Jill Vitale-Aussem, and I am privileged to serve as the president and CEO of Christian Living Communities, a nonprofit senior living and services organization based right here in Denver, Colorado. And with me today in studio is Pam Sullivan, our Vice President of Communications and Philanthropy. And joining us today, we are so excited to have Doug Farmer here. And Doug is the President and CEO of the Colorado Healthcare Association and Center for Assisted Living. So this is the association that supports and represents nursing homes and assisted living communities throughout the state with education and advocacy. And we are thrilled to have you here with us today, Doug. Thank you.
Thank you. Thanks for having me. Looking forward to it.
We appreciate all that you do for all the organizations in the state, along with Leading Age Colorado, right? That's another organization that's very, very important for all of us. So today, we're going to be focusing the conversation on Medicaid funding for nursing homes and assisted livings here in Colorado. So can you walk us through, it's all very complicated.
It is.
It's convoluted, and you have job security, right? So can you help us understand how federal funding flows through the state?
Sure.
And, what happens when federal funding is reduced? What happens here on the ground?
So, there are a variety of ways that Medicaid works, and there's different matching arrangements for different programs. But as it pertains to nursing home and assisted living in Colorado, we have a 50-50 match on every dollar. So for every dollar the state spends, they draw down a dollar of federal money as well. So that means that any cuts that come from the national level essentially double at the state level. If they cut $1 million at the national level, that means there's $2 million that isn't going out to providers. And the same arrangement for assisted living. We don't essentially have an assisted living payment, but we do have an HCBS payment that can be provided to assisted living providers. And that too is a 50-50 match. So you ask about, what happens, right? I mean, you want to jump into HR1 and what's happening in Colorado, how that's going to impact our folks.
Dive right in. Yeah, let's do this in.
It's the simplest topic on the planet. Yeah, so HR1, this great big bill, it did a handful of things to Colorado, and it's going to have some impacts for a while to come. The largest, I think, right off the bat is going to be the cuts to who is eligible to receive Medicaid. And now I'm not talking about nursing homes or HCBS services. I'm talking about regular access to healthcare and emergency services and those sorts of things. So we think right now, the latest estimates I've seen are that about 100,000 people will end up coming off of Medicaid coverage in the state of Colorado. So that, again, that doesn't directly impact our provider group, but it does indirectly impact us because it impacts the hospitals. The whole point of the ACA when it was passed was to make sure people were insured or covered by Medicaid. And that way, when they're showing up to the hospitals and to the doctor's offices, we don't have these double-digit amounts of uncompensated care, which puts stress on the whole system. So that will impact all providers. It'll impact the whole system. In addition to that, there will be a cut to the hospital provider fee. And the numbers I've seen on that is that it will be about $2 billion a year less than it is right now. And so that is a significant amount of money to the hospitals. Again, this is sort of all stacking up toward hospitals, but it impacts, as you well know, all of our providers. So those two things together put a whole bunch of downward pressure on the state budget. In addition to that, because Colorado's income tax system is directly linked to the federal income tax system, when HR1 passed, it changed a lot of tax levels for lots of different people. That impact comes through Colorado's budget as well. So during the regular legislative session that ran from January to May, the legislature had to cut out about $1 billion from the budget. After HR1 passed, they had to go back to the table and find about $750 million worth of revenue to either replace, which they did through some rainy day funds, and or cuts, which they also did. So that's 2 rounds of this. It's going to be, we're going to have more challenges next year. And I know we'll get into that a little bit later, but those right now are the big things that have happened with the Medicaid program. And so why does that matter? Well, because it's a 50-50 program, state legislature and the governor will have to decide how they want to spend their scarce resources, right? They have a set amount of resources, and they'll have to decide if they want to leave them the way they are or change the way they're distributed around the Medicaid program. So that's the impact. It sounds simple, but it's big.
It does not sound simple.
It's absolutely simple. And what it does is, I mean, you started out like, woo, Medicaid's huge, and it's a lot of different types of people.
Right.
We obviously in our area care about the older adults. They have fewer resources and they don't have opportunity to make more resources.
Right.
So what's on the table, really? I mean, you talked about big numbers, big people, but what's on the table with the people who live here in Colorado and what the state has to decide and the governor has to decide?
So do you mean like for assistance? So for example, so not everybody out there knows that, right? That Medicaid, some nursing homes a lot of nursing homes are Medicaid licensed, and where our most of our communities are. So low income elders receive care and services there long term. And then assisted living too, right? Through the HCBS program, there are assisted living communities where people who are low income can afford to live there. And that's where we care about everybody here, but when we focus our energy on, my goodness, what's going to happen to elders?
Yes.
It's really thinking about those areas. And so, yeah, that's a really big question.
Yeah. So
What's
let's
on
get
the
down to actual people, right? Not just including numbers. And so it will really just depend on what the legislature and the governor choose to do, right? How they focus the resource that they have to support the Medicaid program. What I would argue is that we need to be starting with what Medicaid was designed for, and that is taking care of elderly and disabled Coloradans and Americans. And so my argument would be we're the only provider in the entire spectrum of healthcare that is responsible for the whole life of the patient that we care for, right? Our residents, we're responsible for their entire life from start to finish every day, 24/7, 365. So that will be our argument. I think it just really depends on what happens, right? If they did across the board cuts right now in state general fund terms, right? To get $1 billion off the books, they have to cut just over 6% of every state general fund resource they have. That's schools, that's highways, that's meals, that's nursing homes and hospitals. So that would be catastrophic, quite frankly, especially in the nursing home arena. We don't have a whole lot of assisted living that's paid for by the Medicaid program right now. It's really a sliver.
Well, because the reimbursement is already so poor that it's hard to make it work, right? But we have some. And we're making it work, and it's by a shoestring, right?
By a really thin budget.
Yes,
but very, very worried people.
Yeah.
Yeah, and I
they
think
were really worried.
that's a legitimate worry.
Yeah.
I mean, it's a concern. I think, what we've seen over the past couple of years is not a growth in the number of assisted living communities that accept Medicaid, but a restriction.
Right.
We're seeing fewer and fewer of them, and that's really difficult because then you're, an individual is faced with the decision of, well, I could go into a nursing home. That could be where I could get my care, or do I try and stay out in the community and scrap it together? And it's not easy, right? It is not. We talk about a healthcare system, but what we really have is a healthcare conglomeration. It's not a system that's welded together. It's just it's handheld, right? And so if any little piece of that system starts to falter, everybody feels, the ripple.
When we're housing and healthcare.
Right.
Right. And when we have people that have moved into some of our Medicaid assisted living communities who say, I would be in a homeless shelter.
Right.
And when you are not housed, all of a sudden, all of your chronic healthcare conditions, downstream, in addition to what the horrible things that can happen to a human, like what happens with our healthcare system and the costs.
Right.
If we don't provide these supportive services.
And we see this all the time with unhoused people in particular, that when they come to a nursing home, for instance, right, and they get regular sustenance. They get good balanced meals. They get medications under control. They get their health conditions taken care of. They get to a functional level where, okay, I could live back in the community now. I don't need to be in a nursing home. But oftentimes they're discharged out to the community. And if they can't keep those wraparound services together, they wind up in an ER and back in a nursing home. And again,
Double waiting
you're just
for the hospital.
It is. Yeah, it's just
They'll get the 6% cut themselves, and then our cut for the nursing home, they're going to have more people in their ER.
right.
It's just going to be a double whammy.
And again, they'll have this tremendous pressure to a hospital is not designed as a place for you to stay for very long, right? You're supposed to come through the doors, figure out what's going on with you, address that, and then send you back out where you can be taken care of at home or in a nursing home or an assisted living community or wherever. But the hospitals are not designed to hold people for long periods of time. And so when they start to back up, now the normal things that they do there, they're not able to do because they don't have the space to do it in.
Yeah, I remember there was a Wall Street Journal article about this on the East Coast.
Yeah.
I think it was in Boston where a lot of nursing homes had closed because of reimbursement rates being so poor and the backup in the hospitals and people waiting months in the hospital, right? And then all of a sudden, like you said, their emergency rooms backed up and then other people can't access the services they need. And then for that elder who's in the hospital, every day you're in the hospital, your cognitive and physical well-being declines.
Yes.
Right, and you're more likely to get infections, and you're not a place to live. Yeah. So it's just it's very concerning to think about.
Well, and in Colorado too, if you really look at the demographics of the whole situation, and again, we care about all people. All people need services, but we're getting older in Colorado.
Definitely.
And so this is something that we can address now and get ahead of now for the future. What should the policymakers be thinking about when they think about the demographic shift in Colorado?
So many things. So many things. You know, I think front and center, right, obviously is the funding question, because you mentioned, Jill, that so many nursing homes in Colorado do accept Medicaid. Well, it's 85-ish% of the nursing homes that take Medicaid. And in those nursing homes, 80% of the care is paid for by the Medicaid program.
Right.
So
exactly.
It's huge, right? And so a couple of things, right? First, we have to start projecting realistically it's a weird term, right? They call it old. It's the old. Yeah, the 80 plus population, right? And that's where you really start to see, that's about the average age of a nursing home resident in our state. That's where you really have to watch carefully for projections of what's going to happen, right, with the population in the nursing homes. We have to be planning for that and trying to figure out what we can do financially to make it work. I think you're both well aware of the Taxpayer Bill of Rights. That is a constraint that's constitutionally placed around our budget every year. And it means that you can grow, you could take this year's budget, next year's budget can be a combination of this year's budget, plus whatever happens with general inflation, plus whatever happens with population growth. And you put those things together and it comes out, over the past several years, it's been about 3.5% increase. But if you flip that around and you look at what's happened with medical care inflation in Colorado specifically, it's twice that.
Wow.
Right? In average and getting bigger every year. So 3 years ago, it was a little over 5% and then a little over 6%. And now it's almost 8%, right? It is running away upward while our state resources are staying relatively flat. And so if lawmakers can't find a way to address that, then we have a simple math problem.
And population is not growing as much here in Colorado. Right. It used to. Right. So every year it's going to get tighter and tighter.
That's right. And our 65 plus population is projected to grow more than 30% from now to 2035. So a 10-year time frame, a 30% increase in our 65 plus population. At the same time, relatively flat growth in the working age population. And so right now we know we have a caregiver gap, right? Our caregiver ratios are off. And it's only projected to get worse and worse. So we have to be doing something right now, not just about the finances, right, to help pay for the care, but figuring out who's going to provide that care. The workforce issue for me is probably the biggest one of all, right? As we get older as a state, and we've traditionally been a very young state,
We have been.
but now we're starting to get older and come closer to the mean, right?
As everyone who came here for the mountain
Came in the 70s, right?
yeah, and they're still here and they still enjoy the Colorado lifestyle, which is great.
Right.
But have we been attracting the people to come back and backfill? And there's the birth rate too figures into that, and it's
flat.
It's flat.
Yeah.
Yeah.
And this so it's so wrapped up in so many things, right? I've had lawmakers ask me, well, what do we do about the workforce issue? And the answer is like 8 things, right? I mean, realistically, one of them is that we need to be training more people, attracting more people to medical care, healthcare as a profession. But within our sector, we need to be attracting people to long-term care and senior care specifically, right? And so part of that is,
Three or there is.
yeah, so
Yep,
right?
it is.
The 3 of us are really smart, so we didn't choose it on accident, right? But I think no matter what, like Pam said about our population, right? It's flat growth. So wrapped up and intertwined in this is also immigration policy. We're going to have a conversation about a rational immigration policy because we simply do not have enough people to care for our population. And moving forward, that just gets more and more compounded. So that's got to be part of the conversation too.
Okay, the head's spinning right now.
Yeah.
What do the average Coloradoan do about the Medicaid? What should we be thinking about? You know, the session starts, January 14th, I think it is.
Yep. Don't remind me of that, please.
There's a lot to
Not with that, what can we do to impact this? And then why should people care? I think it's a 2-part question. Because you might be like, look, I'm, this age, I'm not worried about it. I don't have, Medicaid doesn't take care of me, so I'm not worried about it. But why should people care and what do they do about it?
Yeah, I mean, why they should care, there's so many different reasons why we should care. But I think if you just want to get right down to like an individual, right, working their day-to-day job, they have health insurance, they're middle-aged, they don't need much, right? Why should you care? Well, in Colorado, Medicaid pays for almost 40% of all the health care that's provided in our state. So if Medicaid gets cut and there's a bunch of unreimbursed care showing up at the doors of hospitals and doctors' offices, that money doesn't just evaporate, right? That cost differential gets built into what you're paying for your health insurance. Right. So your health insurance, if you think it's expensive now, if we see continued and sustained cuts to Medicaid, those things have to be paid for somewhere. And so it comes through private insurance and employer-sponsored insurance. And if you run your own company, you're about to see increases in your health insurance costs today. But if uncompensated care starts to grow like it was in the 80s and the early 90s, it's only going to be higher and less affordable. So businesses won't be able to afford it. Individuals won't be able to afford it. That's why you should care at that level, right? At your own pocketbook level if you're not interested in Medicaid right now.
Right.
But what can be done about it? There's a lot that can be done about it.
I want to add one other thing real quick. Just to that is that I think sometimes people are like, people who have Medicaid as their payer source aren't like me. And we know from our community, with the people that live in our communities who have Medicaid as a payer source, and also people who live in our affordable housing, are retired teachers. Right. We are mechanics. Right. They are people who are just like everybody else and outlived their resources.
We have an administrator of a private school who's now going on Medicaid. I mean, she served 35 years in the private school system as an administrator. And here she is.
Yep.
Yeah. Those stories.
So the othering, I think, makes people like, well, that doesn't impact. But it's people just like every one of us who are impacted.
I mean, I promise you have a friend or a family member who maybe doesn't qualify for Medicaid today, but it takes very few circumstances in their life to change to make them heavily reliant on it.
Driftway away for one
illness, one diagnosis.
Right. Yeah. Big diagnosis or a job loss or any of those things, right? And if that safety net's not there, what do you do? Where do you go? You go to the hospital. They have no choice but to serve you there. Right. But if you think it's expensive when you're paying for it, imagine when you're not. Right.
Yeah. Going back to that access thing, if the hospitals are just jam-packed with unreimbursed care, you're not going to get the services that you need.
No.
Even if you have great insurance, you're just not going to get the services. There's only so many people in healthcare
Yeah.
who are going to be there to serve you. And they're going to be filled taking care of the ones that they have to because they have no other choice.
Yeah.
So it's a big circle. Everyone
should care.
everyone should care.
Everyone.
Everyone
And
should
what
care.
should we do? Now that we care, what do we do?
Yeah, I mean, a couple of things, right? I think for those of us that operate organizations that are in this space that care about this, right, these issues, our main job is to educate other people on what the real issues are, because there's so much sound out there, right? So much noise. You can try to get yourself educated by watching the news. You can try to get yourself educated by reading the papers or blogs or whatever. But there's so much out there. It's really hard to like bring it all into focus and say, here's the one or two things I really care about. You got to get out there, and you have to be in front of lawmakers, and it has to be persistent, and it has to be clear and unwavering, right? So that's a big part of my job is working with lawmakers. And it's really not like you think of a lobbyist, right? You think there's some special magic that goes along with it. There's not. It's just telling stories. It's getting in there and making sure, right? A lawmaker is responsible for everything from highways to the cleanliness of our air to schools to healthcare. So they're a mile wide, but they may be only half a foot deep on a lot of different issues, right? So our job is to make sure they understand, and they understand the why. And a lot of them do. They understand it, but hearing it directly from constituents, hearing it directly from the people that it impacts is entirely different than hearing it from the people that are providing the care. They need to be hearing it from everyone care, but really getting residents and family members and just people who understand the importance of a safety net to get out there and have conversations with our lawmakers is job number one.
And remember, lawmakers are there to represent you. They
Yes.
should be hearing from you. That's their job. So if you're not bothering anyone, you're not, that's their job. And your job as a citizen is to have your voice be heard, right? You should have your voice heard in what you care about. So if you know your neighbor, a family member, your teacher, anyone who's been in your life who is, currently relying on Medicaid or getting ready to rely on Medicaid as their payer source, you need to tell the stories of them and how they touched your lives.
Yeah, and you are so right that people, average citizens look at the legislature and think, whoa, that's bigger than me. And if you look at it all as one thing while it's happening, it's big and it feels intimidating. But when you go sit down with your lawmaker, you're sitting down with a neighbor. They were a school teacher. They might have been a doctor or a lawyer, but many of them are school teachers, or they worked for community organizations, or they worked at your grocery store, right? They're people just like us. I mean, and you especially in my line of work, in my day-to-day, I hear lots of people complain about the political environment and the outcomes of elections and those sorts of things. And then I ask, did you vote? Right? And so if the answer is no, you didn't vote, well, now you're frustrated about something you could have done something about.
Right.
The same thing goes for the outcomes in our state
Forfeit
house.
your right to complain if you don't get involved.
You
and
have
try
to speak
change
up,
it, right?
Yeah, you have to. Otherwise, you've just thrown it out there and hope for the best.
Yeah.
That's just not a strategy, right? So
And there's a lot of different ways. I mean, for example, all of our lawmakers have a contact me button on their website. So you can write something. Let's say you're working an odd shift. You can do that. Look in the newspapers or online. They all have public forums.
always, yes.
Show up to one of them. Talk to them. You don't have to have the one-on-ones are very effective, but not everyone can accommodate that in their daily lives.
Right.
But there's so many different ways to contact your lawmaker and have your voice be heard.
If you go to your lawmaker's webpage, they definitely have a I want to stay contacted button. You click on that, you'll get emails from them, maybe more than you want. But you will definitely find out when they're going to be at the community center or when they're going to be at a parade or wherever else. It's an opportunity to talk.
And if you don't know who your elected representatives are, there's a website you can go to for that too. You just go and Google and say, who are my state elected representatives? And it'll take you to a website that will you put in your address in and
Shows you your house, your state senate, and also who your U.S. House of Representatives is. So
I've heard in a couple different arenas that this may be the most contentious session in years that we're going into at the State House. Is that your prediction as well, or what should we expect?
I think it will be the most challenging that I've participated in since I've been here, and that's 11 years. Yeah, unquestionably. I think, when I look at the people and the organizations that we represent at CHCA, I look at last year and I say, okay, look, we got in the nursing home arena, we kept a 1.5% increase at a time when they cut $1 billion out of the budget, which was, again, that was almost 5.5% at that time.
Yeah.
Then they reduced spending by another $500 million or $400 million. And again, we kept our 1.5%. So we've been through 2 rounds of.
We lost our
We lost our assisted living, the 1.5% there. You're right. I don't know how the math works out when you now have to cut another $1 billion. That's the equivalent of 6.5%. When Medicaid is such a large percentage of the state's budget, right? It's this huge component of the budget, and so I don't know how it goes.
Give you optimism. Give us something to be hopeful for, Doug.
Well,
I feel like I do feel a call to action. Yes, I do feel like, I'm kind of rallying here.
That's what
That makes me feel good, right? Okay.
I mean, the optimism is that we have a good story.
Yep.
And the story is truth, right? It's not fabricated, and it's not hard for any of us to tell, right? It's very easy. You told the story already about a school teacher, right? Or school administrator that needed Medicaid. You could tell, and so could all of your employees tell, a really compelling story about the importance of Medicaid in assisted living and in nursing homes right now without giving it any thought. They have something that sticks right in their head, a person, situation. Yeah. And so I feel encouraged by the fact that we do have a good story to tell. We are representing, from where I stand, you can lobby for all kinds of different things, right? But I wake up in the morning and I feel passionate about who I serve and who we serve, right? Who you all serve. And so it's very hard for lawmakers to just go, seniors will be fine. None of them do that either. Right. So I'm encouraged by that. I'm just not so sure about the financial picture. I just don't see a way out right now, right? The long-term answer is finding some other way than what we have right now, right? The Taxpayers' Bill of Rights is, I don't want to get overly political about it, but the reality is that constraint on the state budget makes it impossible for lawmakers to say, hey, look, we'd like to give you a 10% increase so that we can encourage more Medicaid assisted living. The money's simply not there. It's not. And even if they generated it with new tax sources, they can't spend it.
They can't.
Right? Constitutionally, they can't spend it. They just have to give it back. So that's the part that I'm just not so sure. To me, what I walk away with is a sense of mission, right? That this is very difficult. It's easy to fight when there's no hard fighting. And right now is the time for the difficult fights. And I feel like the people in our profession are ready for it. Yeah. Right? They're primed.
That gives me great hope. Me is the people that work in this field.
Completely. They're here by choice.
Yes. Right.
They're not here because, right? Yeah. They could be doing, anybody in either of your care settings or any of your types of care settings could be doing that work somewhere else. Yeah. And really, honestly, maybe making more money. Don't show this to workers, people that are working.
You just told us about our labor issues, so let's.
But I'm.
People are drawn by the love of elders and a passion for what they do.
Right. It's one of the few places that you get to experience. I think it's an honorable position to be able to be there in the latter years of someone's life, right? And so people are drawn to that. You can't get that from pay. You can't get that from the type of desk you have or whatever, but your office environment. So I feel good about that part.
Yeah, I do too.
Well, it sounds like gear up for the big fight.
Yes.
In a very respectful way. I want to put that in there because I really want people to have healthy discord, and start thinking differently. We need to start thinking differently. And what does that look like? I have no idea. Out of box thinking. I have no idea what that looks like. But this is the time to start doing that because of what's coming down the pipeline with all the demographic shifts and the continuing, the tax base isn't going to be there. So what are we going to have to do?
Right. And you know this about your own business, right? Nothing happens overnight. Nothing meaningful or impactful happens just because you go, I have this great idea. We're just going to do it and it's going to be fine. No, it takes lots of time. It takes conversation. It takes hearing different perspectives, but starting that conversation now, because if we're still sitting here in 2035 and the three of us are having this conversation then, and we haven't done any, foreplanning or haven't had any of the conversations, it'll be a disaster.
Right.
a disaster. So it's starting the conversations now, understanding we can't expect it to fix itself overnight, but getting ourselves pointed in the right direction and then putting support behind all of that.
You know, it just kind of entered my head as you were talking about that. That's what we need to do. What do adult children who aren't in our business start to do now to start preparing for the future? I mean, and older adults are in their 70s. I mean, it's a different mindset, I think. I mean,
yeah, there's another area for opportunity, right?
Yeah.
I think it is a uniquely American thing that we don't think about the end of life until it smacks us in the face. And we ignore it. We act like it doesn't happen. My first job in aging services was in 1999. We had this exact same conversation in 1999, and I don't feel like it's changed a whole lot, right? And I get it from my friends who are adult children. Their parents are starting to be in those positions where they're now having tough conversations, trying to figure out what they want for themselves. You see the siblings arguing about what's best for mom or dad, but not talking to mom and dad. But it really, a big part of it is having that conversation with the people in your life that matter to you, right? Whether they're friends or people at church or in the community or your family members or your spouse or your children, but being clear about, just having the conversations about what possibilities there are.
Right.
We all think we're going to live to be 100. We all think we're going to be like Jack LaLanne, right? Swimming across the channel when we're 80 with a boat tied around our neck. Like, maybe, but maybe not. So let's have that conversation. I had this talk with my folks more than 20 years ago. So, look, I hope when you pass, your last check bounces, right? I don't want your money out of your thing.
Exactly.
But I also hope you have something that gives me some kind of guidance for what you want if you're in a position where you can't make your own decisions.
Right.
That's what I want from them. That's what I want adult children to be doing now. But on top of that, like we talked about, this Medicaid situation will impact your parents. It will impact your friends. It will impact you at some point.
That's the point.
So at least if there's one thing you can do right now, if there's one thing you can go say to a lawmaker, it's please don't do anything to disrupt support for senior services, right? Whether it's nursing homes or whether it's assisted living or whether it's access to food or access to housing, whatever that might be. It's just making the message clear that we, please do something to support and don't do anything to detract from care for senior citizens.
Yeah, that sums it up.
That sums it up. And we will have a lot of resources in our podcast notes on how to find your lawmaker, how to advocate, links to your website, because you've got a lot of good resources on it. So we'll have a lot going on.
And all it takes is the first step.
It does.
Just contact one, right? I mean, if you've never done it before, just reach out, contact your lawmakers. Like Doug and Pam said, we elected these folks and they represent us. And so they want to hear from us, and they should. So thank you. Thank you, Ham. Yeah. Doug, we really appreciate you being here with us. Thank you for all that you do and the organization does. And thank you to all of our listeners and our viewers here today to joining us for Aging Unscripted. A reminder that aging is indeed unscripted. Please subscribe on your favorite streaming channel and share with other people. All of us have a journey that is as individual as we are. And not everyone receives the gift of aging. It's a sacred phase of life that should be honored and celebrated. Thanks for joining us here today. Thanks, Doug.
Thank you.
Bye.